How do I get rid of sexual pain? Well, hopefully you saw my previous video, because how you get rid of sexual pain really determines on what's causing the sexual pain. First things first, you have to get an accurate assessment and diagnosis as to what's causing the pain. If you don't have an accurate diagnosis and your doctor is treating something totally different from what's actually causing the pain, well, then that pain's never going to get better. To get an accurate diagnosis, you need to see someone who's trained in sexual medicine. Probably you need to see a few people. Seeing a sexual medicine provider, and you can find a sexual medicine provider on a couple different websites. There's ishwish.org, the International Society of Women's Sexual Health. They have a list of sexual medicine providers. And then there's ISSM, the International Society of Sexual Medicine. They have a list of sexual medicine providers. ISSM is more male providers for male sexual health concerns, and ishwish is for female sexual health concerns. Finding a sexual medicine provider is going to be incredibly important. Someone who's trained in this area and can do a really accurate assessment and give you a really accurate diagnosis. That's one step. You're probably also going to want to see a pelvic floor physical therapist. A lot of sexual health concerns can be caused by the bowl of muscles that are in your pelvic floor. There are 24 muscles in your pelvic floor. If those muscles are too weak, if those muscles are too tight, those can cause sexual health concerns. So seeing a pelvic floor physical therapist can also help give you a more accurate assessment of what's going on with the muscles. And you can find a pelvic floor physical therapist at hermanandwallace.com. So finding a good sexual medicine provider, finding a pelvic floor physical therapist, and then finding a really good certified sex therapist who will be able to do more of the psychological assessment piece. So you'll have the biological piece with the medicine physician, you'll have the muscular piece with the pelvic physical therapist, and then the psychological piece with the sex therapist. Psychological and relational. The sex therapist will also assess what's going on in the relationship, because that can cause sexual health concerns. Having this entire team, and I know this sounds like a lot. Yeah, this is like a lot of people to have on board to get an accurate diagnosis, but this really is the gold standard way for you to figure out what's going on, get a good, accurate diagnosis, and then that is going to determine what the treatment options are. One other thing I want to add, if this sounds really discouraging, is a research study came out showing that women with sexual pain, on average, saw 6 providers. They saw 6 providers before they received an accurate sexual health diagnosis or an accurate diagnosis, which I know can sound really discouraging, because oftentimes when I talk to women, they're seeing multiple providers and their concerns are getting dismissed left, right, and center until they finally find the right provider. So take a look at these links and see if you can find a provider that will listen to you, that has the training, that can give you an accurate diagnosis.